What do you call it when you have a strong irrational fear of something?
A phobia?
One type of phobia is a social phobia. That's the fear of other people or social situations.
Glossophobia, or stage fright, is a social phobia.
Specific phobia, fear of a specific panic trigger. Women are twice as likely to suffer from specific phobia as men.
I'm Jordan Cobb and I have trypophobia.
What is trypophobia?
Trypophobia is the fear of clusters of holes.
How does it feel when you see clusters of holes?
I get like really shaky and my stomach starts to hurt really bad.
Agoraphobia, generalized fear of leaving home or a soft, familiar, safe area.
I can't go, it's safe in here. I can't do it.
Dr. Hannibal, what is the cause of phobias?
In most cases, the cause of phobias is what is known as classical conditioning. And in this case, a stimulus, for example, a feared object, is paired with a response, which in this case is generally fear or elevated anxiety. So for example, perhaps a young child is quite frightened by a dog at some point in time. And consequently, they avoid dogs. They're quite fearful of dogs, and they develop a phobia of dogs. And because they avoid them, they never learn that dogs are not particularly dangerous, and that perpetuates itself and is reinforced each and every time they continue to avoid that which they fear.
This is kind of scary. Oh my God. Oh my God. Some fears are so severe that the person will avoid the object or situation at all costs. Deja, why did you avoid that water fountain?
Germs, they are everywhere.
Well, there's a number of ways to treat a phobia. And some of the most common ways involve behavioral programming. Because it's caused by classical conditioning, behavioral programming that can address that classical conditioning and teach new behaviors is the most effective. One of the most common ways is to do systematic desensitization. And in systematic desensitization, one gradually exposes themselves to the feared object. So if we go back to the child that's afraid of a dog, rather than putting them in a room with the dog right away, perhaps we start by having them look at a picture of the dog, rating their anxiety, allowing their anxiety to decrease as they continue to look at a picture of a dog, and learn that dogs do not necessarily result in anxiety. And then as the systematic desensitization progresses, perhaps then they're able to hold a stuffed animal dog. Approximating the real feared object is really the goal of systematic desensitization. And ultimately being able to tolerate the level of anxiety that is evoked from that particular stimuli and learning that the anxiety will subside and it is not necessarily a feared object.